Did you know that heart attacks peak at the ages of 65 for men and 72 for women? These are pivotal ages when the risk of life-threatening cardiovascular events dramatically increases. But here's the surprising part. Despite this knowledge, most people don't know how to take control of their heart health and actively prevent such outcomes. Why does this happen? Why is such vital information often overlooked or misunderstood? Today, we're going to change that. We're diving into one of the most critical yet neglected aspects of heart health: arterial plaque. Understanding it could be the key to safeguarding your life. Stay with us, because what you're about to learn could not only save your life, but also transform the way you view your overall health. Let's begin this journey of discovery. It all starts with a single, fundamental question. Do you have arterial plaque? This question might sound simple, but the answer can reveal a lot about your risk for heart attacks, strokes, and even overall longevity. Yet, how many of us have ever stopped to ask ourselves this? My name is Dr. Health, and I'm here to help you understand this crucial topic. With years of experience in preventive medicine, I've worked with countless patients, uncovering the hidden risks that often go unnoticed until it's too late. I've dedicated my career to making complex medical insights accessible to everyone. Today, I'll show you how to identify arterial plaque using a method so simple, you can do it at home with just a blood pressure monitor. Are you ready to take control of your heart health? Let's dive in. Imagine this. You've always considered yourself relatively healthy. You try to stay active, eat balanced meals, and avoid habits you know are harmful. But lately, something feels off. Every time you push yourself during exercise, a dull but noticeable pain creeps into your chest. It's not sharp, but it's persistent enough to make you uneasy. At the same time, you've started feeling more fatigued than usual. Even simple tasks that used to be effortless now leave you drained. You feel slower, weaker, and unable to shake the nagging feeling that something isn't quite right. Worried, you schedule an appointment with your doctor. At the clinic, they ask a few questions, run some routine tests, and then deliver their verdict. Your cholesterol levels are too high. This is dangerous because it can lead to blocked arteries, increasing your risk of a heart attack. The solution? A prescription for a cholesterol-lowering pill. The doctor hands you the slip, offers a brief explanation about cholesterol, and reassures you that the medication will help manage the issue. But as you leave the office, doubts begin to creep in. Why do I have high cholesterol? You wonder. What did I do wrong? You've made healthier choices in recent years, cutting down on junk food, exercising more, and even watching your portions. So why are these problems showing up now? You thought you were doing everything right. This is a scenario faced by countless people. They're left confused, frustrated, and above all, afraid. The advice they receive often focuses on cholesterol levels, but something critical gets overlooked. The real enemy isn't just cholesterol, it's arterial plaque. But what exactly is arterial plaque? Most people picture it as a waxy, fatty substance lining the insides of their arteries, gradually building up until it clogs the flow of blood. While there's some truth to that, this description misses the bigger picture. The reality is far more complex and far more dangerous. Plaque isn't just fat. It's an inflammatory mixture of cholesterol, immune cells, and cellular debris. Think of it as a sticky, slimy substance, more like mucus than wax. It forms within the walls of your arteries, not just on the surface where blood flows. And here's the dangerous part. It doesn't need to completely block your artery to cause life-threatening damage. If the plaque becomes unstable and ruptures, it can release a flood of inflammatory material into your bloodstream, triggering the formation of a massive clot. This clot acts like a dam, suddenly cutting off blood flow. If it happens in the arteries supplying your heart, the result is a heart attack. If it happens in the arteries leading to your brain, it causes a stroke. It's not a slow, gradual process. It's a catastrophic event. And here's what many doctors fail to explain. Cholesterol is just one part of the equation. High cholesterol is a risk factor, but the real danger lies in how your body responds to it. Inflammation is the hidden culprit that turns cholesterol into deadly plaque. Understanding this distinction is critical. If you focus solely on lowering cholesterol without addressing plaque and inflammation, you could still be at risk. The good news? There's a way to find out if you're in danger, and it doesn't require expensive tests or invasive procedures. In fact, you can do it from the comfort of your home. Let's dive deeper into what arterial plaque really is, how it forms, and how you can identify it using a simple test. To truly understand arterial plaque, let's unravel the misconceptions. Most people imagine plaque as a thick, waxy substance coating the inside of their arteries, a simple buildup of fat that narrows the space where blood flows. While this image is common, it's misleading. The reality of plaque is far more complicated and far more dangerous. Arterial plaque is not merely cholesterol lodged in your arteries. It's a complex and inflammatory concoction that forms within the walls of your arteries, hidden from plain sight. This mixture contains cholesterol, immune cells, damaged tissues, and other substances your body produces in response to injury or stress. Think of it as a sticky, viscous sludge, more like mucus or snot than wax. Now, here's where it gets critical. Plaque doesn't need to block an artery completely to be life-threatening. The real danger lies in its instability. When plaque builds up, it can remain hidden and silent for years. But if it becomes inflamed, it may rupture like a balloon popping under pressure. When this rupture occurs, the contents of the plaque spill into your bloodstream, triggering a rapid clotting response. This clot is what causes heart attacks and strokes. It blocks blood flow abruptly and without warning. In the case of your heart, this means parts of the muscle don't receive oxygen and begin to die, leading to a heart attack. If the clot travels to your brain, it cuts off the blood supply there, resulting in a stroke. It's sudden, catastrophic, and often fatal. But here's the hidden truth many don't know. Cholesterol levels alone don't tell the whole story. You could have high cholesterol but stable plaque, which poses little immediate risk. Conversely, you could have relatively normal cholesterol but unstable plaque that's ready to rupture. That's why understanding plaque, and more importantly, testing for it, is essential. Inflammation plays a pivotal role in plaque formation and rupture. Your body views cholesterol and other substances as invaders, triggering an immune response. White blood cells flood the area, trying to repair the damage, but they can't resolve the problem. Instead, they add to the inflammation, creating a vicious cycle where the plaque becomes more unstable. Fortunately, there are ways to detect plaque early, even before symptoms arise. Advanced imaging tests like coronary calcium scans or carotid ultrasounds can provide a detailed view of your arteries. But these methods are expensive, require a visit to a clinic, and may not be accessible to everyone. That's why today we'll focus on a simple, practical method you can do at home: the ankle brachial index, ABI, test. This test is a game changer. It measures blood flow in your arms and legs, giving you a snapshot of your arterial health. And the best part? It requires only a blood pressure monitor and a few minutes of your time. Before we dive into how to perform the test, let's first understand why it's so effective in identifying plaque. The ankle brachial index, ABI, test is an invaluable tool for assessing the health of your arteries and detecting the presence of arterial plaque. Unlike advanced imaging techniques that require specialized equipment, trained professionals, and considerable expense, the ABI test is simple, cost-effective, and can be done at home with basic tools. It provides a critical insight into your cardiovascular health by revealing differences in blood pressure between your arms and legs. Here's how it works. Under normal circumstances, the arteries in your arms and legs should have similar blood pressure readings. But when arterial plaque builds up in the arteries supplying your legs, it can obstruct blood flow, causing the blood pressure in your legs to drop relative to that in your arms. This measurable difference is what the ABI test detects, making it an excellent early warning system for arterial health problems. One of the primary conditions the ABI test helps identify is peripheral artery disease, PAD. PAD occurs when narrowed or hardened arteries reduce blood flow to the extremities, especially the legs. This condition is not only uncomfortable, causing symptoms like pain, cramping, and fatigue, but also dangerous. PAD significantly increases the risk of heart attacks and strokes because it signals the presence of systemic arterial plaque. However, the ABI test isn't just about detecting PAD. It's also a valuable indicator of your overall cardiovascular health. If your results are normal, it suggests your arteries are functioning well. If your results show abnormalities, it's a sign that you may need further evaluation and possibly intervention to address arterial plaque and reduce your risk of cardiovascular events. Limitations and precautions of the ABI test. While the ABI test is a powerful tool, it's important to understand its limitations. It is excellent at identifying severe arterial problems, like advanced PAD, but it may not detect more subtle issues. For instance, individuals in the early stages of plaque development might have normal ABI results even though underlying inflammation and plaque buildup are present. That's why, even if your results are normal, you should remain vigilant about other risk factors and symptoms. Additionally, the ABI test is not suitable for everyone. If you have been diagnosed with deep vein thrombosis, DVT, a condition involving blood clots in the veins of your legs, or if you experience severe, unexplained leg pain, you should avoid this test and consult a healthcare professional instead. In these cases, alternative diagnostic methods may be more appropriate. Now that you understand the significance of the ABI test and its role in detecting arterial plaque, let's move on to how you can perform this test in the comfort of your own home. Step-by-step guide to performing the ABI test at home. Performing the ABI test at home is straightforward, but attention to detail is essential for accurate results. Here's a detailed guide to walk you through the process. 1. Gather your tools. To begin, you'll need a blood pressure monitor with a cuff that fits both your arm and ankle, a pen and paper or a digital notepad to record your readings, a quiet, comfortable space where you can lie down flat and rest. 2. Prepare your space. Find a calm, quiet environment where you can lie down without distractions. A couch, bed, or yoga mat on the floor works well. It's essential to rest for at least 5 to 10 minutes before taking your readings. Blood pressure can vary based on activity, so this resting period helps stabilize your readings. 3. Set up your notes. Create a table or list with 4 sections. Left arm, right arm, left ankle, right ankle. This organization will help you record your measurements systematically and avoid confusion. 4. Take readings from your arms. Begin with your left arm. Wrap the blood pressure cuff snugly around your upper arm, ensuring it's positioned correctly over the artery. The cuff should be firm but not overly tight, allowing for accurate pressure detection. Activate the monitor and wait for the reading to display. Write down the systolic, upper number, and diastolic, lower number pressures. For example, 120/80 mmHg. Repeat the process on your right arm and note the results. 5. Take readings from your ankles. Move the cuff to your left ankle. Wrap it just above the ankle bone, ensuring the bladder of the cuff aligns with the artery running along the top of your foot. Start the monitor and wait for the reading. Record the systolic and diastolic pressures, just as you did for your arms. Repeat the process for your right ankle and note the results. 6. Double-check your readings. If any readings seem inconsistent or significantly different, repeat the measurement to confirm accuracy. Blood pressure can vary slightly, but large discrepancies should be double-checked. 7. Restate and review your notes. Once you have all 4 readings, review them to ensure they are clearly recorded and organized. You should have 2 systolic readings for your arms and 2 for your ankles. Next steps. Calculating the ABI. With your readings in hand, the next step is calculating your ABI. This simple calculation will help you interpret the results and determine the health of your arteries. Stay with us as we guide you through the process of turning these numbers into actionable insights. Now that you've measured your blood pressure at key points on your body, it's time to calculate your ankle brachial index, ABI. This calculation transforms your measurements into actionable insights about the health of your arteries. It's a straightforward process, but understanding each step ensures accuracy and clarity. 1. Identify the highest systolic pressures. Your ABI calculation focuses on systolic pressure, the first and higher number in your blood pressure reading, which measures the force of blood as your heart beats. To proceed, look at the systolic pressure readings for both ankles. Select the highest value between your left and right ankles. Do the same for your arms. Identify the highest systolic pressure between your left and right arm readings. Example: let's say you recorded the following. Left ankle, 126 out of 74. Right ankle, 120 of 59. Left arm, 114 to 72. Right arm, 107 to 69. In this case, the highest systolic pressure for your ankles is 126, and for your arms, it is 114. Repeat for each leg. The ABI can be calculated separately for your left and right ankles. This provides a comprehensive view of blood flow in both legs and helps identify any asymmetry, which can also indicate potential issues. 4. Interpret your ABI results. Now that you've calculated your ABI, let's analyze what your results mean. The ABI values fall into distinct ranges that indicate different levels of arterial health. Healthy arteries, 1.0 to 1.4. This range indicates normal blood flow and healthy, flexible arteries. If your ABI falls here, your arteries are likely free of significant plaque or narrowing. Borderline or mild issues, 0.9 to 1.0. This slightly lower range suggests mild narrowing or stiffness in your arteries. It's not yet critical, but it warrants attention and proactive lifestyle changes to prevent further decline. Significant plaque buildup, PAD, below 0.9. This range is concerning and often signals peripheral artery disease, PAD. PAD involves restricted blood flow caused by arterial plaque and increases your risk of serious cardiovascular events. Abnormally high values, above 1.4. While higher may sound better, it's not. A value above 1.4 often indicates arteriosclerosis, or hardening of the arteries. This condition reduces arterial flexibility, which can impair blood flow and elevate your risk of complications. Why the ABI test matters. The ABI test does more than measure the health of your legs. It provides a snapshot of your entire cardiovascular system. That's because arterial plaque isn't confined to one area. It's a systemic issue that can affect any artery in your body. Here's what makes the ABI so valuable. Early detection of PAD. Peripheral artery disease, PAD, is often called a silent killer because it develops gradually, with symptoms like pain, cramping, or fatigue in the legs appearing only in later stages. The ABI test can catch PAD early, allowing for timely intervention. Indicator of cardiovascular risk. Even if you don't have PAD, An abnormal ABI can signal increased risk for heart attacks and strokes. That's because the presence of plaque in your leg arteries often mirrors plaque in critical arteries elsewhere, such as those leading to your heart and brain. What your ABI results reveal about arms and ankles. You might wonder why the ABI test compares blood pressure in your arms and ankles. The answer lies in the unique challenges faced by the arteries in your legs. Leg arteries are longer, narrower, and rely on muscle movement to pump blood back to the heart. They also work against gravity, which makes them more susceptible to plaque buildup, hardening, and damage. By comparing blood pressure in your arms, which generally experience less strain, to your ankles, the ABI test identifies imbalances that could signal significant arterial problems. Peripheral artery disease. PAD, a closer look. Peripheral artery disease, PAD, is one of the most significant conditions the ABI test can reveal. This chronic condition involves the narrowing or blockage of arteries in your limbs, most commonly the legs. Here's why it's so concerning. What happens in PAD? When plaque builds up in your leg arteries, it restricts blood flow. This deprives your muscles, nerves, and tissues of oxygen and nutrients, causing them to gradually weaken and die. Over time, untreated PAD can lead to severe pain and cramping, claudication, coldness or numbness in the feet and toes, non-healing wounds or ulcers on the lower legs or feet, loss of hair or shiny skin on the legs, indicating tissue damage. The bigger picture. PAD is often a red flag for systemic cardiovascular problems. If plaque is obstructing blood flow in your legs, there's a high likelihood that similar issues exist in your heart or brain arteries, significantly increasing your risk of heart attacks and strokes. What to do after getting your results? The ABI test is just the first step in managing your cardiovascular health. Depending on your results, here's what to do next. 1. If your ABI is normal, 1.0 to 1.4, congratulations, your arteries are functioning well. However, this doesn't mean you're immune to cardiovascular risks. Plaque can still develop over time, so focus on maintaining healthy habits, including a balanced, heart-healthy diet low in saturated fats and high in fiber, regular physical activity to promote circulation and arterial flexibility, avoiding smoking and managing stress levels to reduce inflammation. 2. If your ABI is borderline or abnormal, below 0.9 or above 1.4, abnormal results warrant further investigation. Consult a healthcare provider and share your ABI results. They may recommend additional tests, such as Doppler ultrasound, to visualize blood flow and detect blockages, CT or MRI angiography, for detailed imaging of your arteries, coronary calcium scan, to assess plaque levels in your heart arteries. Additionally, lifestyle changes become even more critical. Adopting a heart-healthy diet, incorporating more physical activity, and managing conditions like high blood pressure or diabetes can slow or reverse arterial damage. The ABI test is a powerful tool, but its true value lies in what you do with the results. Whether your numbers indicate healthy arteries or areas of concern, this knowledge empowers you to take charge of your cardiovascular health. Remember, the earlier you act, the greater your chances of preventing serious complications. If you're ready to dive deeper into lifestyle changes that can reverse plaque buildup, stabilize your arteries, and reduce your risk of heart attacks and strokes, check out our next video. Together, we'll explore practical steps to transform your heart health and secure a longer, healthier life.